Fresno County and the city of Fresno. We want to talk today about the results from our 2019 point in time count. And the point in time count, just for a little education, is a piece that's required by HUD for us to count. We're required each year to count the sheltered population and every other year to count our unsheltered population. The Fresno Madera Continuum of Care has decided to count both populations each year since 2013. We do this so that it helps us stay on top of where our homeless population is, our homeless count, and what the changes in our community are. As we all have seen and experienced, we've seen an increase in homelessness in our community. And we've seen an increase in the last couple of years. So most communities right now are comparing 2017 to 2019 because they didn't do an unsheltered count in 2018. But we did. So our population has changed at this point. Is in the city of Fresno, we've gone up to, our numbers have changed to 217. We've increased 217 unsheltered persons in Fresno, and in the city of Fresno, and in the county, 993. So our total Fresno City unsheltered count is 1,152. Our sheltered count is 334. And in the county, our unsheltered count is 636, and our sheltered count is 9. So, as I said, we've seen an increase, but we're not the only ones that have seen an increase. Communities across California have seen an increase, and from the Hub for Urban Initiatives, they reported out that 24 of the COCs that counted 53,595 persons in 2017 unsheltered, and then went up to 66,305 persons in 2019, which represents a 23.7% average across those 24 that have reported out so far. So we're not alone. That doesn't mean that we sit back and we wait. We're pretty excited on the fact that our mayors, along with the other 11 mayors, went out and got some additional money from the governor. And for the FMCOC in the county, we put out services and are expecting to, in July, to ramp out services for 90 shelter beds, 33 bridge housing beds, diversion services to help keep people from coming into shelter or being homeless that will serve approximately about 300 people, rapid rehousing services, navigation services, as well as landlord mitigation and engagement, and youth shelter and navigation. I'm pleased to be here today with Supervisor Magsig and the mayor, and I'm going to turn this over at this point to the supervisor to give you a little bit more information.
Thank you, Shawn. So to address the influx in homeless that we've seen in Fresno County, I'm pleased to report to all of you today that the city of Fresno, as well as the county and the 14 other cities in Fresno County, have been proactively working on this issue that we've been facing. So we've come up with a list of priorities that all of us have agreed on and all of us had an opportunity to have influence over. At the Board of Supervisors meeting just this last Tuesday, that 14-point document was approved by the entire Board of Supervisors. Here in about a week or week and a half, I believe the city of Fresno is going to have an opportunity to adopt that same document. And again, that document was created through the time and effort of the mayor, as well as 3 council members from the city of Fresno that are on the homelessness task force, and the other 14 cities throughout Fresno County. So we're excited that we're beginning to build a framework, a foundation where all of us can have agreement so we can get at this challenge that we're facing. Homelessness is a cross-jurisdictional problem. It's something which doesn't exist just in the city of Fresno or just in the county of Fresno. It affects us everywhere, and we're watching homelessness increase. So the only way that we can be efficient really getting at solving this problem is working together. And it's more than just government that has to work together to get at this problem. We need to be working with the nonprofit sector. And I'm excited to report to you that the nonprofits that are out there, from Fresno Economic Opportunities Commission to Habitat for Humanity, which is building housing, we're all finding ways to connect the dots, work together, the Housing Authority, for all of us to come together to address this problem. There's collaboration between the continuum of care, the cities, the county, and all of this assures greater success as we deal with these challenges moving forward. One fit or one solution to this problem doesn't work for all of us. When you look at homelessness and how people become homeless, some people have mental health issues, others have addiction issues, some have lost jobs. So we have issues of housing, we have issues of mental health. And so as we look at the homeless problem, we can't come up with one solution and believe that it's going to work for all of us. And so as we work together as a group and as we get out into the community even more and get to know who the homeless are and how they got there, we can begin to develop plans to get at solving homelessness in a much more effective and efficient way. Discussions continue with legislators for more flexible funding to address homelessness. So the Board of Supervisors has been very proactive, and I need to give a lot of credit to our CAO, Jean Rousseau, as well as Sonia De La Rosa, who works directly under Jean Rousseau. She has been reaching out at the federal level, the state level, and continuing to working with all the cities in Fresno County to come up with solutions, but making sure that as the federal government provides additional funding sources, as the state provides additional funding sources, that the strings that are attached to those monies are workable for us in Fresno County. So at this time, I'd like to introduce the mayor, who also has a few comments that he'd like to make around the point-in-time count.
Thank you. First of all, I want to thank the organizations and agencies represented here today for their efforts to find a collaborative, comprehensive solution to the homeless problem. When I speak to my fellow big city mayors in California, homelessness is always a top issue for the past 2 years. With few exceptions, most cities are showing increases in their numbers of unsheltered homeless, the latest point-in-time count that Shawn's already talked about. Every one of these organizations is committed to reducing homelessness in ways that both affirm the dignity of every homeless person while preserving the quality of life for everyone in the city. Fresno's risen to this challenge before. In 2010, during the Great Recession, homelessness numbers in Fresno reached 5,000, almost unprecedented for our area. Committee leaders came together to align resources to close down the dangerous downtown encampments back in 2010. And the result was a 60% reduction in homelessness between 2011 and 2017, the highest rate of reduction by any West Coast city, according to the U.S. Interagency Council on Homelessness. However, said earlier, by 2018, homelessness was again on the rise, spreading to every corner in the city and every corner in the county. We're now up to 1,486 in the city. And today I'm calling upon our partners at the city, the Continuum of Care, and throughout the entire community to once again rise to the occasion, to redouble our collaborative efforts to provide help for homeless people. And I'm grateful for the partnership that we have forged with the county and its agencies, with the Continuum of Care, and other nonprofits. And last year, Governor Brown awarded us $14 million, of which $3.1 million directed to the city of Fresno to give us the resources that we need. We're using our funding to roll out housing and services starting this summer, including small, low-barrier shelters strategically located in the community with a path for permanent housing. Proactive resources to prevent homelessness of at-risk families, and housing with area landlords offering assistance to mitigate their risk and renting to folks fresh off the streets. I'm also encouraged that Governor Newsom has pledged additional money in the upcoming state budget to make these important programs sustainable. And we're going from $500 million to $650 million. There should be a substantial change or increase in our funding. This plan is not new and builds upon the previous plan that has worked in the Central Valley. Simply put, we need to step up our efforts and rise to the challenge. And I'm proud to be here with my colleagues and partners that go back over a year. Unprecedented collaboration between the city and the county, the Continuum of Care. We're only going to solve this working together. Thank you.
think that what you heard is a challenge to rise to the problem that we have. And it is a problem in our community. It's not just a problem for the business community, it's not problems for the neighbors, it's problems for the people that have to live on the streets. So it is a community problem, and it's only going to be solved by the community. There's not one agency that's going to solve this problem. The county can't solve it by itself. The city can't solve it by itself. The continuum of care can't solve it by itself. The business district can't solve it by themselves. The faith-based community can't solve it by themselves. It's going to take a collaborative effort of all of us working together. We want to make sure that we're using this new money in an effective, strategic manner, giving exits to shelter. We do not want to hide our populations. We want to bring them in, shelter them, and then put them back into housing and get them back into the community. So it's strategic. There's a reason why we've picked the interventions that we've picked. You'll hear people say, well, this sounds like the same thing. It's not the same thing, because these services have never been funded in the past. We've never had funded shelters. We've never had landlord mitigation. We've never had diversion strategies. So these are new services, and we are committed to evaluate and adjust as necessary. We're also committed to the collaboration and working with all partners and learning from each other. It's not, and nobody owns this problem. It's our problem, and it's only us together that are going to solve it. So if there's any questions, we're open for questions.
I think it's fabulous that you're going to be opening up the 90 beds and shelters come July. But just even looking at your own numbers, it's showing negative of homeless people wanting to go into the shelters. Negative 25%, negative 10% in Madera City, negative 2%, almost 3% in Fresno. How are you going to get these people to go into these shelters to use these services?
So that's a little bit misleading, the piece that you're looking at. So the shelter beds, what they're doing is they're counting the number of people in those shelter beds at that night, at that one point in time that night. And so we didn't really have any increase in shelter this year over last year. It just means that there was 10 less people for some reason that given night. There may have been 15 more people in there the night before or the night after. So, but the way we're going to do it is we do have outreach, and we're doing outreach. Right now, there isn't any funded shelter besides our shelter right now is bridge housing and what they call grant per diem, which is a transitional housing for veteran services. But we don't have a triage center. We don't have where we can just walk somebody in right now that's funded. So the number is a little misleading on that. And so we have people that are asking for help. And the piece is, and we hear it a lot, is that you have people that refuse services. And my comment is, well, when we can deal with all the people that want housing and want services, then I think it's appropriate to really look at the people that are left over. But we haven't even had the resources to deal with all the people that have wanted housing yet.
Last year there was a pretty significant decrease in chronic homelessness. I remember it was like more than 30%. Do we have any information on what it was from last year to now in terms of if there's been an increase or decrease of that in our area?
We do. I can get that to you. I don't have it off the top of my head. And the reason, I can tell you the reason why. So if you look at that, our homeless count went up, but our chronic number went down. And that was because of an intense focus by the Continuum. Let's see. Chronic homelessness went from 2018 was at 482, and it went to 675. So we focused our efforts on the chronic homeless and pushed all of our dollars to the chronic homeless. But one of the things that does happen when you do that, chronic homelessness is a definition by HUD. So how long you've been homeless or how many times you've been homeless over a course of time. And so when you're focused on the chronic homeless, then you have somebody that's about to be chronic homeless that's not getting the resources. So, but we have used an intense effort to really look at the most vulnerable people on our list. We have a master by name list of all the homeless people, and we prioritize that by the most vulnerable people on the streets.
Good. If you folks want any one-on-ones, we can set that up too. Thank you, everybody.